The Western medical model, and I don't mean the science of it, I mean the practice of it, because the science is completely at odds with the practice. The practice of it makes two devastating separations. First of all, we separate the mind from the body. We separate the emotions from the physiology. So we don't see how the physiology of people reflects their lifelong emotional experience. So we separate the mind from the body, which is not something that traditional medicine has done. I mean, Ayurvedic or Chinese medicine or shamanic tribal cultures, medicinal practices throughout the world have always recognized that mind and body are inseparable. They intuitively knew it. Many Western practitioners have known this, have even taught it, but in practice we ignore it. And then we separate the individual from the environment. So the studies are clear, for example, that when people are emotionally isolated, they tend to get sick more quickly and they succumb more rapidly to their disease. Why? Because people's physiology is completely related to their psychological social environment. And when people are isolated and alone, their stress levels are much higher because there's nothing there to help them modulate their stress. And physiologically, it's straightforward. You know, it takes a 5-year-old kid to understand it. However, because in practice we separate them, when somebody shows up with an inflamed joint, all we do is we give them an anti-inflammatory. Or, because the immune system is hyperactive and is attacking them, we give them a medication to suppress the immune system. Or we give them a stress hormone, like cortisol or one of its analogs, to suppress the inflammation. But we never ask, what does this manifest about your life? What does it say about your relationships? How stressful is your job? To what extent do you lack control in your life? Where are you not authentic? How are you trying to work so hard to meet your attachment needs by suppressing yourself? Because that's what you learned to do as a kid. Then we will do all this research that has to do with cell biology. So we keep looking for the cause of cancer in the cell. Now, there's a wonderful quote in the New York Times. A couple of years ago, they did a series on cancer, and somebody said, looking for the cause of cancer inside the individual cell is like trying to understand a traffic jam by studying the internal combustion engine. We'll never understand it, but we spend hundreds of billions of dollars a year looking at the cause of cancer inside the cell, not recognizing that the cell exists in interaction with the environment, and that the genes are modulated by the environment. They're turned on and off by the environment. So the impact of not understanding the unity of emotions and physiology, on the one hand, and on the other hand, the relationship between the individual and the environment. In other words, having a strictly biological model as opposed to what has been called a biopsychosocial model that recognizes that the biology is important, but it also reflects our psychological and social relationships, and therefore trying to understand the biology in isolation from the psychological and social environment is futile. The result is that we're treating people purely through pharmaceuticals or physical interventions, greatly to the profit of companies that manufacture pharmaceuticals and which fund the research, but it leaves us very much in the dark about A, the causes, and B, the treatment, the holistic treatment of most conditions. And so that for all our amazing interventions and technological marvels, we're still far short of doing what we could do. Were we mindful of that unity? So the consequences are devastating. Economically, they're devastating. Emotionally, they're devastating. Medically, I was in Massachusetts last year speaking there, and I was told that the local HMOs, the health maintenance organizations, GPs get 6 minutes a patient, 10 patients an hour. And the psychiatrist gets 10 minutes. Now what can you do in 10 minutes? If somebody comes to me with a rash, by the way, what do we call a rash? We call it an eruption. What else erupts? Well, anger erupts. Guess what? Rashes often have to do with the suppression of anger. So that's how it erupts, in the form of a skin rash. It takes me a minute to prescribe a cortisol cream, the stress hormone cream, which will suppress the inflammation. But for them to be talking about their lives, no, that would take some time. When the HMO tells me I got 6 minutes a patient, and if I'm a psychiatrist, I get a whole 10 minutes, what can I do besides prescribe a medication? You know, so there's that. But the basic limitation is not a financial one. It's also an ideological one, and it has to do with those blinders we talked about earlier. The fact that physicians are not trained that way. They get their own unresolved stuff. They don't know how to relate to this information. Yes, the whole system is devastatingly stupid and blind. Now, there are pockets of light.